You know, Thursdays always when we talk to people from the medical community. Today, Dr. GiGi MacDonald is here talking to us about establishing that relationship with your primary care physician and why it's so important. When I saw this, when the email was sent, and I heard relationship with the doctor, what does that exactly mean to have a relationship with your physician? Because for me, it's just, I show up, I have my appointment, and I leave.
Absolutely. So one of the things I think about when I first see a patient is establishing a relationship or rapport, getting to know them. It's really important for me to know them not only on a physical level and their medical needs, but emotional level as well. Because it's only with that trust that you build and that rapport that you have that I can then help them.
Could that be a specific appointment for you to get that interaction, or do you try to get that through the medical appointment that they're for?
Oh, through the medical appointment that they're for. So right now, being a new provider in the area, I meet patients for the first time all the time. And during that, that's how I establish a relationship. I say, hi, my name is Dr. MacDonald. I'm going to get to know you. You're going to get to know me. I'm going to be your guide through medicine. And we're going to have an open conversation to be able to get you there. So you start that the first time you meet them, and then every subsequent time you just build on it.
And one of the main goals of this is the preventative care that you can get for that patient, correct?
Absolutely. And so preventative care, I think, is one of the most important things that I can do for a patient. It's my responsibility. It keeps them the healthiest them for years to come. So I think about it in a patient, if I can prevent hypertension, if I can prevent coronary artery disease, or if I can prevent cancer, it's going to help cut down on medications, possible side effects. I see it as keeping them the most functional that they can be and the most independent that they can be for their life to come.
Do you find that that personal relationship also is, that person is more likely to come to you? I know growing up, I had a doctor, I mean, I was out of his state. I was afraid of him.
Yeah.
But when you have that relationship, does it make it easier for the patient to want to come see you?
Absolutely. And I say medicine has changed. Probably in the last 10 years, there's been a change in the way that we look at patient-physician relationships. I don't wear my white coat. I don't stand above a patient. I sit beside them and I talk to them one-on-one. I kind of think of them as if they are my family member, how would I want them treated? And so bringing that to them makes them more comfortable. So we'll get personal phone calls saying, hey, Dr. MacDonald, could you take care of this for me? Or hey, Dr. MacDonald, I saw a specialist today and they told me this advice, but I'm not sure what I should do. What should I do? Yeah. And I love that relationship because then I can help guide them. And
that is something, you know, you heard it from the doctor there, you want to call the physician when you have a question. Don't call the guy on TV because I don't know what I'm talking about.
Absolutely.
I appreciate it.
Very nice meeting you.
We'll be right back.